welcome to the Central Safety Group June event. I'm Nan Austin, the president of the Central Safety Group. I'm just thinking that I'd like to remind our members that we're trying to put together some member profiles so we can actually share some expertise and interests amongst our members. So look out for more emails. We'll be sending out pro formas, and hopefully you can introduce yourself on a single PowerPoint slide to share on our website. As Marina said, please stay on mute during the session. If you want to ask a question, you can use the chat function, and I'll try and moderate that through to Jason so that your questions can be asked, but there will be an open session towards the end so you can all contribute to those discussions. Other than that, I shall hand over to Jason. Jason is the president of Workplace Health Without Borders, Australian branch. And I think this will put our work into perspective when we see what's actually happening across the world around unhealthy and unsafe conditions in work sites. And hopefully Jason will be able to promote how we can maybe contribute to some existing programs internationally. So super exciting, and I look forward to the presentation. So thank you, Jason. Over to you.
Great, thank you so much, Nan. I will share my screen. Let me know if you can see my screen now. All good, excellent, cool, great. Well, no, thank you, Nan, thank you, Moan, thank you, Jane, for inviting me on for today. So, yeah, we're going to have a good look at Workplace Health Without Borders today. I'm the current president of the Workplace Health Without Borders Australian branch, and so I just wanted to thank everyone for joining us today. So I'll just start with an acknowledgement of country. I'd like to begin to acknowledge the traditional owners of this land that I'm on today, the Eora people, and I also want to acknowledge the Gumbaynggirr people as well, which is where I grew up in the north coast of New South Wales. So I pay my respects to elders past, present and emerging. All right, I just wanted to quickly do a real quick flyover occupational hygiene. I'm sure there's quite a few people on the call that know what occupational hygienists are, but sometimes people don't. So yeah, essentially, yeah, occupational hygienists and people like us, I suppose, have a passion for occupational health, for worker health, and it's about the prevention of health and disease in the workplace. And so how we do that is we undertake risk assessments for all different types of hazards: noise, dust, heat stress, chemicals, mold, COVID, all sorts of things. And as you can see here, this is, I suppose, a good schematic which indicates, you know, what happens when there isn't that prevention, there isn't that sort of short circuit of where hygienists and other health and safety professionals come in. So we've got our disease, we've got our diagnosis, treatment, and sometimes people that come out the other end as healthy, but sometimes they don't. So that's where we sort of come in and bring in that preventative sort of aspect to trying to short circuit this circle. And so, yeah, so it's about the anticipation, the recognition, the evaluation and control of the hazards. Okay. So I just want to give you a quick story about this guy before we get into WHWB, just to give you a bit of context around, you know, what I do and why I do it, and a lot of the health and safety professionals that in WHWB do. So this guy, he's he used to be a timber cutter. He grew up in the bush, essentially. As you can see here, he's yeah, not wearing shoes or a shirt or anything like that. And he spent his first sort of working decade in the bush, working with chainsaws, working with engines, working with all sorts of stuff. And then he moved out of the bush and moved into the city and became a mechanic. And for many decades, he was a mechanic, and so he was working with noisy pieces of equipment. He was working with lots of sort of chemicals and greases and cutting fluids and all sorts of things. And I suppose essentially at the end of his work career, yeah, he had some issues, and as you can see here, this is his audiometric report for his left ear and right ear. And if you've read these or seen these before, you can see here that his right ear has a massive noise-induced hearing loss. So he's essentially deaf in the right ear, and his left ear is not looking very good as well. So so unfortunately, he has noise-induced hearing loss, and because of all the cutting fluids and chemicals and things that he's used as a mechanic. He's got stage 1 bladder cancer. So I think it's just a good sort of story to mention around how people can in their workplace be exposed over many decades and not really know it, not really realise, and then at their end of their career, then they have these issues. And this person happens to be my father. So yeah, so just wanted to share that with you. So let's get into it. So we're going to go and have a good look at what WHWB is, what we do, why we do it. We're going to have a look at the international branches, some of the exciting things they've done and what they're doing, and having a deep dive into what we're doing in Australia. Okay, so WHWB, so we're global volunteers, and we're a network essentially for the promotion of occ health and safety. So I mean, very similar to you guys and girls on the call today. Our vision is a world in which workers and their families and communities do not get ill because of their work. Yeah, it's a simple thing, but obviously it's not. It's an extremely hard thing to obviously get across the line, especially in some of these other parts of the world. So our mission is to prevent work-related disease and injury around the world through shared experience, knowledge, and skills. So yeah, we have these knowledge, we have these skills. And we want to advocate for workers essentially through this organisation. So we're all different sorts of people. We're health physicians. We're working in medical situations. We're occupational hygienists. We're health and safety officers. We're all different sorts of people. But I suppose our focus is the work health and safety for workers in areas which have limited access to this type of information, this type of monitoring and assessment and any insight, I suppose, into these types of hazards. And it's generally around the low to medium income countries around the world, but also in richer nations as well, such as Australia. Yeah, so that's essentially where we're working and why we sort of want to do that. So I just wanted to have a look at essentially occupational hygiene and how it looks worldwide. So there's some multiple studies here where we've picked out some information here. So this looks at the number of deaths essentially per year worldwide. And so as you can see, we've got armed conflict, road traffic, HIV/AIDS, and at the bottom, if you're not counting COVID, mind you, occupational injuries and disease is way out in front. So that's essentially 2.78 million people per year. But then obviously if you bring in the COVID situation, that is starting to dwarf that. And just for your information, that was figures mid-2021, I believe. So yeah, 3.5 million there. So yeah, I mean, I suppose COVID is relevant for WHWB and for the world essentially. So I just thought I'd quickly share some of the latest figures from the World Health Organization. I pulled these off this morning from a couple of days ago, essentially. So we're still looking at 2,100 new deaths worldwide daily, 6.3 million deaths worldwide. And yeah, 532 million cumulative cases of COVID positive people. They're the official figures, but unfortunately, the WHWO don't actually believe they're their own figures. And some of you may be aware of this, but yeah, these numbers are getting undercounted and seriously undercounted in certain countries. I just wanted to highlight India. So unfortunately, yeah, so because of numerous issues, as you can see here on the right, these are mortality rates. So you can see India is essentially sitting at 1.1, and then we've got all of these other countries here of deaths per 100 cases. So the mortality rates that are being reported in these other areas are hugely increased in comparison to India. So why is that? So unfortunately, they're underestimating their COVID deaths. So officially, they're saying that they're around 475,000 deaths, but unfortunately, people have estimated that it's essentially 10 times that amount. So 4.74 million people have passed away from COVID in India, and I suppose in some of these other countries as well, they've had issues with reporting. So their counting methodologies are quite poor. They've got poor disease health surveillance within the medical system, and sometimes poor death record issuing of death records. So organising on from there, so distribution worldwide of mortality. So you can see this is from the Global Estimates organisation. So this was relatively recent. So you can see there's a good spread here of where the people are the mortality rates in certain regions. So obviously Oceania, where we are here, is quite low. Obviously Africa, Europe, America, and then so the huge significant part of that pie is Asia. So essentially that's directly above where we are in the Oceania, and so that's where we sort of WHWB Australia want to sort of play in that area, because that's where we can try and make the biggest impact that we can. So I just want to share this as well with you as well. So when we're talking about some of these compromised economies and workforces and workplaces, they talk about the informal economy. So essentially where a lot of these workers are working, they're working within an informal economy. They may be, obviously it might be a cash-based economy, and so it's very difficult to get information around these sort of workplaces or work industries. So you can see here, obviously Australia and the Northern Americas have a significant, significantly less percentage of these informal economy workers. But as you can see here, from looking towards India, and that's definitely Africa in particular, 90% and over 90% of these people, in the majority of Africa, are working within this informal economy. And so that's sort of the workers, I suppose, that we essentially want to try and focus on. So when we look at, I suppose, risk assessing and looking sort of at what we want to focus on, what is hazardous work is one of the questions we want to answer. And I suppose the International Labour Organization has some good definitions around that, and I'm sure you could understand some of the definitions there. So physical, psychological, or sexual abuse, workers working underground, working with dangerous machinery, manual handling of heavy loads, obviously chemical hazardous chemical agents, noise, vibration, heat stress. Obviously heat stress is going to be a big issue in certain parts of these parts of the world, particularly around India. And then obviously overall stressful conditions. So I mean, these are some of these things that we need to look at when we're looking at some of these situations. So I suppose these areas where we are wanting to assist and advocate for, there's a severe shortage of occupational hygiene and health and safety individuals. I mean, we're just talking here around occupational hygiene or industrial hygiene, as people may have heard. It's an American term. So yeah, essentially there is around 8,000. There certainly would be more of those now, around 16 countries. So you can see where the stars are. And then essentially in those other parts of the world, there's very little to no representation of these subject matter experts, or even people with good knowledge around occupational hygiene and health and safety. So could be potentially a need for up to 44,000 more people to essentially match these services in these other countries. So that's obviously an extremely difficult task. So yeah, so bringing it back to SARS-CoV-2, as we full well know, I suppose people are getting to that point now where they do realise that this is a real and a significant occupational hygiene issue and a hygiene disease. So some good stats here, which I've recently got together from the International Labour research people. So 5.9 million deaths as of, I think that was earlier on this year. 14% of COVID cases reported to the World Health Organization, which are from healthcare workers, and some of those figures are even much higher than that in some of those other countries. And obviously there's risks to non-healthcare workers as well, but maybe even higher. So certainly COVID is a big issue worldwide, as we know. All right, so let's have a look at WHWB and some of the activities and programs and things like that that we've been involved. So WHWB as an organisation started in Canada, just over 10 years now ago, and so it's sort of grown slowly from there. So we've got 2,000 people within our actual larger global network. We've got well over 800 members worldwide. We have about sort of 25 members in Australia, and that's growing. So yeah, we're certainly the youngest of the branches around the world. Yeah, we're starting to gather some momentum. We offer mentorship, which I'll discuss later. We have been involved with providing equipment donations to organisations through certain suppliers. As an organisation, we have a Occupational Hygiene Training Association accreditation, so we're able to provide that customised, experienced and knowledgeable trainers to do that OHTA training, which is around the worldwide training association for hygiene. We want to be involved, I suppose, in policy and most definitely advocacy. So advocacy is a big part of what we do, and highlighting things that are happening around the world and what are sort of the latest things that we see that need more information and more insight into. So I think that's definitely one of the big things that we're about. And we've got lots of obviously previous projects that WHWB has done, but unfortunately because of COVID, as you can understand, that has stifled a lot of our work that we've had that we want to do, I suppose, overseas and advocate for and work. So now we're coming out of COVID, and so we're looking to get more into a lot of these other activities and projects, which I'll discuss with you a little bit later on. Okay, so moving on from there, so WHWB have a strategic framework. We have an operational plan that was adopted in January 2021. Yeah, I won't go into huge detail around that, but I suppose essentially that's provides the foundation of what we do, why we do, how we do it. And that's within both of those documents. It discusses the principles and priorities that we want to be guided by for our activities. It includes policies, collaborations, and knowledge sharing, I suppose, avenues. It includes what we do on the ground with regards to training. It has areas of action that we want to look at, which we're sort of discussing today. It talks about ensuring activities are aligned with United Nations Sustainable Development Goals. So it's important that we want to be in line with the UN. And then I suppose a lot of the operational sort of plan information there talks about governance, communication, fundraising, coordination with other branches, policies, and also research and technical assistance and training. So yeah, so there's quite a lot of good information in those documents, just so that we're aligned and working on the same page worldwide from the different branches. So we've been involved with quite a lot of education and webinars, similar to what we're doing, presenting to you guys and girls today. We've obviously COVID-19 and things around those situations have come to the forefront, which is exciting for us. But I suppose getting that information across in a simple and digestible and understandable sort of way is certainly a challenge. And I think with a lot of these webinars, that's what we've tried to do. So there's been a lot of different things around aerosol transmission. I'm sure everyone's fully aware of COVID-19 is airborne. Looking at infection control sort of situations, respirators and respirator fit testing, I think, is certainly a big one that we've been looking at. So one of my personal passions, and so a lot of different things that we've done around webinars and things like that to do with schools, to do with informal work, focusing on particular areas around the world and trying to provide that more information and conversation, I suppose, around a lot of these aspects. So some of the really awesome projects that we've done in the past as WHWB as a collective. So you can see here we've been in the past working with brick kilns, and obviously silica is a big issue with bricks and those other types of products. In Nepal and Egypt and Pakistan. We've been looking at helping to design local exhaust ventilation using easy to provide products and materials that people can find locally. So LEVs can be quite expensive, but if they're fashioned in a certain way, then they could be quite easily made with relatively cheap and relatively easy materials. So there's obviously waste workers happening in Brazil. That's another project that's been done there, as well as a big project that's done with stone crushers in Tanzania, which we're going to have a look at right now. So hopefully this video works and the sound works as well.
All these patients come from the same mining area of Tanzania. It's called Merirani, and it's in the Lake Manyara region of Tanzania. There, they mine for this precious stone called tanzanite. All the patients are virtually the same. They're all males and have been working in the mining industry for 10 years.
Right? No, it's not working.
They've all been working at the coal face.
I hear it, but the video's not playing.
Exposed to chronic dust in a. All these patients come from the same mining area of Tanzania. It's called Merirani, and it's in the Lake Manyara region.
We're seeing William's video, not the other
precious stone called tanzanite. All the patients are virtually the same. They're all males and have been working in the mining industry for 10 years or more. They've all been working at the coal face of the extraction process and have been exposed to chronic dust inhalation. Virtually all of them are the same without wearing a mask or any protection. When they present to us, they're presenting with extreme shortness of breath. And that can be shortness of breath on even the mildest activity of daily living, such as dressing and eating. This is advanced, or what we call the terminal phase of the disease I'm about to show you on this X-ray. When we see the X-ray here, if we look at this X-ray and compare it to a normal X-ray, we can see the difference. The difference is, in this case, we see white areas involving both lungs very extensively. This is called silicosis, and this is due to extensive fibrosis due to chronic inhalation of the dust from the mining procedure. For this to take place, the patient usually has to be exposed for 10 years or greater. This is irreversible. And by the time the patient presents to us in hospital, they either have terminal respiratory failure or even heart failure secondary to chronic lung disease. And it's what we call a terminal disease at this stage.
So yeah, quite a significant issue within Tanzania and throughout the world, as we are sure you've heard now with silica and also silicosis, with engineered benchtops in Australia. So I'm sure you've seen a lot of that happening, obviously here, but yeah, certainly around the world as well. So yeah, so that's just one of the things that we've been sort of assisting with in other parts of the world. So trying to provide that advocacy, trying to provide information, trying to provide knowledge and training and potentially equipment and basic monitoring as well. So yeah, so some of the things in Australia. So we started in 2018. Elaine Landers was the first president. So yeah, Elaine has done some amazing work getting the Australian branch up and running, and it's been flying very well in the last few years. So that's great. Thank you, Elaine. So we're I think we're up to around sort of 23, 25 members now, and slowly growing. So that's really sort of positive, and we're getting I think we're getting a little bit more traction. I think in the next in the last sort of 6 or 12 months now that we're coming out of COVID, we're now an official 100% charity. We have full charity status, which is great. So that means that we can sort of move a little bit further and sort of look at sort of bigger and better things, such as donations and looking for fundraising activities and ideas and sources for donations. So I mentioned before around mentoring. So we'll be hearing from one of our mentors shortly. So that's something we wanted to develop more and more with our members as well. So I think that's one thing from the Central Safety Group that I wanted to hear about. So we'll be discussing it a little bit more shortly. And so recently as well, we had a basic principles course for occupational hygiene, very generously donated by a company called Red Arms. And so that was amazing that we had a winner of that hygiene course. And so Tennille was the winner. I think Tennille might be on the call today. We were really happy to provide that for a lucky person. And so that was really awesome that we were able to do that. I suppose leading on from that, we do actually have another OC hygiene spot available for another hygiene course. That's in July, and we've put that out onto the socials and to people recently, and so we've got another one we're able to provide to a very lucky person. Only people within Australia, unfortunately, because that's just how the Australian branch is set up. But the applications are open for that, and it's ending in and around June. And so that course is essentially a 5-day basic principles OC hygiene course, which is valued over $2,500. So if you wanted to get that, then you can certainly message me for an application if you want to be in line with that, and for WHWB members of course. So all right, so that's that. I just wanted to then now quickly mention about a potential project which is starting to get some legs and within WHWB Australian branch. So we've been looking at the Philippines, and it's around artisan and small scale gold mining. So you may or may not know, but there's a lot of these type of workers that are doing a significant amount of this type of mining for gold. I think it's around 15%, I think, worldwide, that of these types of workers that are providing gold to the world. And in particular, the Philippines. This is some good information from planetgold.org. 500,000 miners are in this sort of mining sector within the Philippines. 70% of the gold from the Philippines is coming from these workers. Which relates to people assisting 2 million people with their livelihoods and essentially putting food and shelter on these families' tables. But unfortunately, with this this process and with this type of work, it's very hazardous. The idea of essentially there's the mining aspect of getting the ore or the material out of the ground, which is incredibly dangerous if they're digging makeshift type mines and shafts, but also it's the processing of the ore where they unfortunately use a lot of mercury to essentially extract. They mix the mercury in with the ore, and then they essentially they have to vaporize that mercury to extract the gold. And so that's incredibly hazardous for the workers that are working around that. So we want to try and get a bit more information out there around that, and look to provide some controls, provide some additional sort of information for them, provide some training potentially to key people around working mercury free. So yeah, watch this space, and hopefully we'll be doing a little bit more in that area. So you can see there, I suppose the environmental damage from this type of work is another part of this puzzle as well. So I mean, yeah, if we can assist with the prevention of environmental and significant environmental damage, then that's a super plus as well to what we're doing. So yeah, so it's as I've said before, it's around that advocacy, it's around getting involved, trying to get to sort of the key people that are on the ground within these particular areas, so that we can liaise directly with them. They know the language, they know the culture, they know the area where it's happening, and they're able to provide that really good information for us to try and choose where we sort of put our resources, so that we can try and make an impact, essentially. All right, so another really awesome advocation that we've mentioned before is around the lead exposure elimination group. This is all LEAP. They've been working in a lot of parts of the world, but certainly recently in Malawi in Africa. This is another charity organisation that's sort of in quasi partnership or connected, or yeah, we sort of interact together. And Jack Rafferty is the lead there, and they essentially advocate for the lowering of percentages of lead within paint. And we as Australians, and in this area, we know that we've gone through that journey over many decades. And unfortunately, in certain parts of the world, they're nowhere near where we are now. So they have been able to really be on the ground within Africa themselves. And Malawi is one example of where they've actually made some real change. They've advocated, they've lobbied the actual government and provided controls and provided solutions on how to lower the lead levels within the paint, and the actual government has made a commitment to change legislation and change how things are happening in these countries, which is astounding and amazing that they were able to do that. And they're moving on now. They're employing actual people now, and so yeah, big shout out to these guys. They're doing it well. All right, let's quickly jump over to mentoring now. We want to have a quick focus on one of our star mentors. It's Zinzi. She's an African miner. She works in an underground mine in and around Johannesburg in Africa, and so I've been mentoring Zinzi for the last 2 years. And yeah, it's been amazing to see the transformation of Zinzi from someone not that confident, someone just you know, sort of trying to make her way in the hygiene and health and safety field in Africa. It's an extremely daunting prospect, and she's blossoming now. She's got an actual a South African accreditation for occupational hygiene now. And yeah, we can really see some change when we do these mentoring programs. But I'll get Zinzi to tell you herself. And I think I've got to do something with the video here, so hopefully that works now. Give me a thumbs up. No? No.
It's running, but we can't hear it.
No, I think I've got. Let me just try this again
That's
now.
it.
That is it now? Yes.
Hi
Sorry.
everyone, I'm Zinzi Sokoni from South Africa, working in the mining sector. And I too participated in the WHWB mentorship program as an occupational hygiene mentee. I was fortunate enough to get placed with an excellent mentor, and through the partnership and the program, I managed to achieve most of the goals. Admittedly, there's still much more to do and learn, but what we had set out to do prior to the program, or as the program was starting, most of those stuff I have achieved. I've been better capacitated to carry out my duties at work. You know, the confidence it instilled in me, and also on a personal level as well. The personal growth has been immense, and I'm happy about that. So to anybody who's considering the program, for mentees, guys, go for it. I enjoyed it, enjoy the process and be part of it. You know, sometimes it gets a bit hectic, but be part of it and drive the process, because at the end of the day, you have the most to benefit. And to the mentors who are so generous and so giving of their time and the knowledge and their expertise that they share with us, we thank you for that. We thank you, you know, because there isn't much time to go about just sparing, you know, but yet you manage to do that for us, and it benefits us and makes a big difference. So keep that up. Thank you so much.
Yeah, so that's yeah, it's good to get that feedback. So yeah, let me just change this around here and do that. Yeah, so with regards to mentoring, here we are, sorry. Yeah, so we've got this mentoring program going. It's essentially run out of our US and international branch. So essentially the basics process there is that people come to us and request that they want to be a mentor. And so then we sort of put that application in for that, and then mentees are, I suppose, are provided to the organisation, that people that come to us wanting to be mentored, and so then that then that pairing process starts from there. So then there's discussions had around particular people's knowledge levels and their availabilities, and the people trying to linking up people as best they can for, you know, that the mentee and mentor sort of are working together. So that's obviously sometimes very difficult. Being, I mean, certainly there's always more mentees than mentors. So mentors are very time poor, as you could understand, and so yeah, trying to find mentors is always a big issue. So yeah, trying to go through that pairing process and making sure that people are aligned with the mentoring program and with the way that how we want the mentoring to run, essentially. So as you were saying, that the mentee needs to drive these situations and make sure that they're sort of pushing to a certain extent the mentor and driving the process of that, and making sure that these regular hookups are happening, and so that then that pairing is really is fruitful, I suppose, for both sides. And so reverse mentoring is, you know, you may not have heard that, but that is a real thing, that the mentors do get things out of this this relationship as well as the mentees. So some mentees have these extra additional skills. They may have you know, significant digital skills, for example. They might, yeah, that may assist certain mentors greatly. So there is that two-way street of learning as well, which people sometimes don't understand. So mentoring is another one of my passions. And so yeah, I enjoy doing it, and I enjoy seeing people develop from that. So all right, moving on from there, let's have a look at some of the initiatives and some of the things that we're looking at now this year and into the future. So again, fundraising and corporate donors are something that we're wanting to look more into now. As you can understand, we have very little money, and we're all volunteers, and so we need some of this assistance to try and drive some of the things that we're doing, and drive some of the potential overseas operations that we want to facilitate. So we want to expand our membership in the Oceania, and so we've got essentially members within Australia and New Zealand as well. one of our board members is from New Zealand. So that's yeah, we want to expand that membership sort of drive there. We want to look at looking at occupational hygiene programs, I suppose, overseas as part of situations that that we're looking at. And I suppose that Philippines example is one of those things. We're currently looking at Indonesia to assist with banning of asbestos. So this is an international collaboration as well with the other branches, where they're looking at different areas of parts around the world on how we can assist these situations. And obviously Australia is a good news story with regards to asbestos prohibition, and so that's one of the other things that we're looking at. So in the future or later on in this year, we're wanting to do another webinar similar to what we're doing here around further application and relaunching essentially WHWB in Australia. And I suppose we want to continue our advocacy and participation with conferences and things like that. So the International Conference for Occupational Hygiene, Occupational Health is coming up next year. So we want to be at that. And then obviously the Australian Institute of Occupational Hygienists is another key place where we provide insight and presentations as well. Okay, so corporate donors. So you can see here some of our previous amazing corporate donors. Obviously, Red Ohms Group has been extremely good to us recently, and there's a few other sort of people there amongst that group that have assisted with small donations around the around the world. So that's amazing. Okay, so we're just about done on what I wanted to present today, but I suppose there's a few other things around WHWB. So, you know, we're all volunteers, so I suppose it's around that assistance of working on projects, communicating, advocating for certain causes that we think significant, and obviously we want to move more into that fundraising sort of spaces now to try and increase sort of our traction on certain situations. So we want to make sure that is part of what we do, obviously, and around that training and projects. So we want to participate on regular teleconferences and interact with people on other webinars and other situations. So if you want further information around certain things, then you can certainly email that email address there. We've got a YouTube channel as well, and so that's got some really good information and previous webinars and previous talks and things like that as well. So there's lots of really awesome things that are provided on that as well. So yeah, so that's pretty much what I wanted to present to you today. So thank you so much for listening. Just to end with an awesome quote from Benjamin Franklin: "An ounce of prevention is worth a pound of cure." So yeah, thank you so much for listening, and happy to take some questions.
Thank you very much, Jason, for that jam-packed presentation. It's just great to have some of the real-life examples and to actually understand more about what WHWB actually does, particularly through the mentorship, was certainly very interesting. And I hope that some of the persons present might be interested in joining your charity, which congratulations on your status. That will certainly help with bringing in donors, I hope.
Yes, it was quite a challenge, and yeah, there's certainly a lot of hoops and a lot of checks and balances and documentation and things like that to get to that charity status, and rightly so. I mean, we want to make sure that these things are I suppose ironclad, and that just not anyone can put in an application and get this charity status, because we want to make sure that they've got you know, the legitimacy and that they're wanting to you know, do the right thing all the time. So yeah.
Excellent. We had a couple of comments in the chat saying a fabulous presentation, so thanks, Jason. I'd like to invite the others who are present, if you'd like to actually ask Jason a question, please turn your camera on so Jason can see your smiling face while you're asking the question. So any questions from the group that are present?
I don't have a question, but I was just wondering if, as you said, Tennille is here, whether they'd like to tell us anything about the experience.
There we go.
So Neil, I think you're getting put on the spot here.
I am. No, it was, yeah, thank you very much to OHS and Workplace Health, Borders Without Health for providing the course. So I work for an occupational hygiene consultancy myself, came from a safety background. So I knew an overview of hygiene, but definitely doing the course gave such an insight into so many different topics. And obviously having Elaine, Simon, the others from OHS that are available to present and get hands-on in the course as well. That was just fantastic. Elaine's phenomenal teacher, so much life experience and could bring things back down to our level of, there was lots of different levels of experience and education in the room. And yeah, having the equipment available, getting hands-on, that sort of stuff was really good. So even though there was a lot to cover over the course and a little bit of homework each night, it was well presented and well sort of set out that you had enough time to get amongst each topic, because I think there was about 6 or 8 separate topics throughout. So it's definitely a good overview and a basic level, entry level course for anyone interested in hygiene, or yeah, if you're in a position in safety or like nursing, anything like that, or just getting a hygiene technician role. Yeah, it's definitely well worth it, and yeah, I encourage everyone to apply for the competition this round.
Thanks, Tanil. That's fabulous. If there's not any other questions, I might turn off the formal part of the presentation. Though others can.
Sorry, I've got a question.
Oh, sorry, Marina, you just go for it.
Questions now. I'm just wondering because, Jason, I noticed most of the branches, they were started in Canada. There's a UK branch, Australian branch. Was a US branch?
Yeah, no, there's a US branch as
So,
well, yes.
So for the mentorships, I guess there's the language that, you know, that all English speakers. Are you trying to get groups involved from other language areas to assist as well, you know, especially for the mentorship programs?
Potentially, yeah. I mean, if they are, obviously WHWB members, and that they do have a second or a third language, or if it's their first language, if for example from Africa, they might be able to directly assist someone. So that's not something that we're significantly pushing, but we'll certainly be very open to that if someone does come to us with, I suppose, a language barrier that may sort of hamper that mentorship if a particular mentor has just got English, for example, as the one language. So so I think that is something that we could certainly try and assist with, and I suppose we would try and, if that was to happen recently, then we could sort of throw a net out to the members and then see whether or not there was any people potentially able to assist with with bridging that language barrier. Yeah. So
but I guess the people you've found so far, your mentees, all have enough proficiency in English to take advantage of the program. That's been in my experience so far. But in saying that, then someone from America or the UK may have had some further interactions with someone with significant language barriers. So it would certainly be a challenge. But I mean, if they did have that other language, then that would help significantly to allow that smooth knowledge sharing, I suppose. So, and then that they would have that insight into that country, potentially into that culture, into what's happening potentially on the ground there for them. So, yeah. I think Elaine wanted to.
I think to be for clarity, that while there are groups in, I guess, what we would class as Western world, so Australia, England, Canada and America, that doesn't mean that that's the only locations of people that join. And so there are little groups, throughout Africa, throughout Southeast Asia, in India. So there are people that are actively engaged, but they're all in the international group because there's not sufficient, I mean, it's been hard enough trying to set this up here, and it's taken probably, I know Noel Trester was trying to set it up for years and years, and then I took it on. It took me still 3.5 years, no, probably 4 years to get to this stage where we are actually a charity. So I can see why nobody else wants to, but it doesn't mean they're not there to in those local languages. So we're linked, and I went over to help with the Vietnamese International Industrial Occupational Hygiene and Environmental Institute. And so you've got Vietnamese, you've got Lao, you've got Cambodia, so you've got all these individuals who might be silos, they might be completely on their own, but they are there trying to put that message across, and then they receive help. And it's not necessarily mentoring, but obviously it is there, but it's help from them to improve for hygiene, health, etc. in their local countries. And they would be the individuals that would be the mentors for those groups, or those groups of people if they came through.
Jason, Jane here. Jane Loudon speaking. I'm wondering,
Hi, Jane.
Can you hear me?
Yeah,
Yes.
I can. Yes, yes.
What scope is there for us to do a bit of pioneering work in doing mentoring from here to the South Pacific? Those countries where there's not much, I've looked into it, there's nothing much going on there for help from outside. Also, would we have to go through Canada, or could we set up a sub-mentoring group here?
Well, we could certainly look at that. So, I mean, I suppose we want to go through the normal sort of channels through the WHWB of how that's done. So, yeah, I mean, there is scope for that, and I suppose interacting with some of those local hygiene groups, interacting with those organisations that do need mentors. I think whether we sort of trying to reach out to them or provide that information to them to say that we can provide mentors to a certain extent. So there will be limited scope for that, but yeah. So, but at the moment that's sort of how it's sort of set up. So yeah,
I guess
Elaine, did you want to add to that?
Yeah, I guess the ultimate is that international WHWB already has a platform and a system for assigning mentors to mentees, etc. And for us, with the lack of resources that we have, and that's not just financial, given that, you know, we have that few members and really it's just us, you know, 5 or 6 on the board that keep things going. We use their facilities to actually engage that. So while we may actually be the mentors, and that would be much more preferable considering we're in the local region, local, if you know what I mean, we would still use the WHWB International actual platform for organising, etc. Partly that also goes to the fact that, as Jason said, currently we're not internationally recognised as a charity, and that was because we need about another 15 documents with regards to corruption, fraud, terrorism, slavery, etc., etc. Given we'd had delays and issues with lawyers previously, we just wanted to get it up and running fully, and so we chose, and COVID was here, so we weren't doing any international work anyway. We got it up and running as a local charity, and we are now just pulling things together, and we're going through, hopefully by the end of this year, either we will already have international charity status or we will be in the process of achieving it. And once we've got that, we're then actually able to be involved directly with international groups. Whereas, as I say, at the moment, everything really has to be run, otherwise we would be going outside of our ACNC scope. That's probably a good word to use. So we would be breaking our requirements under the legislation. So absolutely, if there are people out there, you know, we are very keen to have mentoring running through our group, and it just needs us to understand where those mentees sit, and then we would actually facilitate that organisation through the international group. So it would be seamless. You know, nobody would realise there was an issue.
Nan, I just had a quick question. I was involved when I was the president of the International Ergonomics Association with a similar program, Ergonomics Without Borders. And with ICO and IOHA, the three, the hygienists, the occupational health and ergonomics, were working with the International Labour Organization and the World Health Organization on their programs. And I'm assuming from what Elaine was saying, that could be a next step for your group once you get that international recognition. But in the meantime, I would imagine that International OC Hygienists Association could provide some tools for you in that space.
Yeah, I think so. So yeah, no, I'd be interested to find out more, David, around how that works. Maybe not on this call, but yeah. So no, I think that's certainly a rabbit hole. I'm more than happy to jump into.
Sure. Okay.
Yeah. Thank you.
Thank you.
In a conversation with me, you mentioned that there's scope for people to offer to give a presentation. Could you elaborate on that?
Sorry, Jane. What
was that?
I may have got it wrong, but I thought you mentioned to me once there was scope for people to offer to give presentations via WHWB on specific subjects.
Like training presentations.
Yes, yeah, that's correct. So I mean, we some of the other officers have actually provided that sort of training, and Elaine mentioned before, actually on the ground training in other countries. So
I'm thinking more Zoom presentations that could go easily overseas.
Yes.
Yeah.
No, definitely. Yeah, certainly. Extensions from the webinars that I mentioned before, and so that there is potential scope for that as well, Jane. Yeah.
Well, I'd certainly encourage people to jump onto the WHWB website, possibly look at becoming a member, so you're eligible for the training, or possible going in for the lucky draw.
Hygiene course. Yes. Yeah.
But you'll have to wrap up now because we're running out of time. I just wanted to say, well, thank you very much. And thank you for joining us also, Elaine and Daniil. That was wonderful to have your contribution as well as Jason. But great presentation, Jason, and startling statistics and great examples of what's happening out there. So just brilliant.
Thank you so much. Thanks for having us, and really great to provide information and insight into what we're doing to your organisation, and I want you to learn more about what you guys and girls do too. So
okay, excellent. I just wanted to just remind our members present a couple of key dates coming up next month, 12th of July. We've got Phil Lovelock giving a presentation in July, and on
sorry, correction, he's August.
Oh, okay.
Dr. Karis Chan.
Oh, thank you very much for the correction.
Sorry, Nan, that's my fault.
That's okay. You'll receive a notice on that. And the other one is the 23rd of September, which will be our 60th anniversary celebration lunch at the Victorian Parliament building. So keep that date in your diary also. So thank you to everybody for joining us. And we look forward to some future connections. So thank you very much.